everyone. I'm Dr. Rachel Rubin. I'm a urologist and sexual medicine specialist, and welcome to another episode of Sex Matters. Today, I actually have an ask for you. I need your voices. I need your help. We spend a lot of time talking about how we have no voice in healthcare, how we can't really make change, and I have an opportunity for you that I need your help with. September 24th, the FDA is collecting public comment about women's health and hormone therapy. And I need your voices because right now we only have about 500 comments from people. And it doesn't matter what your comments are. We want your comments because we must change the landscape of women's health and hormone therapy. Now, I was very blessed. I got to be a part of an expert panel that went to the FDA with the commissioner himself, who asked for us to give our opinions and our thoughts on where we see things in the realm of hormone therapy and women's health. And I want you to watch our testimony. I want you to watch us talk about vaginal hormone therapy and how it can save lives. So here's the deal. Vaginal hormone therapy, estrogen, and DHEA are safe for all humans. They prevent urinary tract infections, urinary frequency, urinary urgency, vaginal dryness, pain with sex, arousal, orgasm. They are sexual health drugs that save lives by preventing urinary tract infections. There have even been publications, including some of our own, that show we could save Medicare billions of dollars a year if women were given safe and effective vaginal hormone therapy. Now, we've been a part of clinical guidelines by the American Urologic Association that has been signed on to by the urogynecologists, the Menopause Society, and the Sexual Health Societies that all talk about the fact that vaginal hormones not only help with pain and dryness and overactive bladder, but they can prevent urinary tract infections. And so for my primary care docs, I need you to learn how to write these prescriptions. I need you to get confident and give it to everybody who has signs and symptoms of genitourinary syndrome of menopause. So the prescriptions are easy to write. You have it within you to do this. And I talk about this at length on all of my channels and with all of my patients. But the most important thing we can do now is talk to the FDA about how we must remove warning labels on these products. Because the truth is, there is a boxed labeling on all estrogen products that say that it causes stroke, heart attack, blood clots, probable dementia, cancer. And if you know the literature, which I do at length, none of it is true. In fact, you can't find me a single paper that shows any of this as happening with vaginal hormone therapy. In fact, the Women's Health Initiative, which is what got the box labeling on there, did a whole part of their study looking at people on vaginal estrogen, and there was no increased risk of stroke, blood clots, cardiovascular disease, or cancer. We know that these medicines are safe. We actually have data that shows 50,000 breast cancer patients using vaginal estrogen had a mortality benefit, not a decrease in mortality. Vaginal hormones are safe. They prevent urinary tract infections. They save lives. You could use a cream, a tube of cream, of estrogen cream can be as cheap as $13 a tube if you get it on cost plus drugs, $30 a tube with GoodRx, and it's often well covered by insurance. You can use 1 gram twice a week and have your patients rub it into the vaginal tissue like you rub moisturizer on your face. That will acidify their tissue, get their pH to 4.5, and prevent urinary tract infections as long as they use it till death do they part. Now they make vaginal inserts, 10 microgram vaginal estradiol inserts that go in the vagina twice a week. You could get a ring, an E-string that can go in for 3 months at a time. You could do vaginal DHEA, a nightly suppository. All of this is laid out for you in full detail in the recent AUA guidelines on genitourinary syndrome of menopause. I said it before, I'll say it again. Vaginal estrogen, vaginal hormones are better than Viagra. They work the same way, actually. They help with arousal, they help with urinary symptoms, they help with sexual health, but they're better than Viagra because they prevent urinary tract infections, and people die of urinary tract infections. These are safe to use if you've had a history of blood clots, if you've had a history of cancer. These are safe to use if you are on whole body hormone therapy. And in fact, guideline statement number 11 talks about how we should be adding and treating vaginal symptoms even in the setting setting of people on hormone therapy. If you have a patient with postmenopausal vaginal bleeding, send them to their gynecologist for a workup, but you don't have to routinely do surveillance of the endometrium here. And if you're using these local products, you do not need to give progesterone with the patient. Now, if you're doing whole body hormone therapy, then if they have a uterus, yes, estrogen and progesterone go together, but not with these local low dose products. And so you can learn this as a primary care physician. You can learn this if you are any kind of doctor, cardiologist, rheumatologist, endocrinologist, you can write these prescriptions. So, but I need you to tell the FDA that their labeling is incorrect, that is false, and that you as a doctor need to have easier way of getting your patients these medications, because our patients see these warning labels and this one's a lie. This one is not correct. So we must get updated labeling. And the head of the FDA knows this. He has asked for our help in getting this through the FDA. He is interested in this, and this is a chance for us to get support. This is something that is supported by the gynecologists, by the urologists. It is supported by by so many medical communities. Even the cancer doctors have support in the use of vaginal hormones to help with the genitourinary syndrome of menopause. So please go to this website before September 25th to have your voices heard. We must have more than 500 comments advocating loudly for women's health. So if you have any further questions, please feel free to reach out, and please use the guidelines for genitourinary syndrome of menopause loudly. You will save lives, you will save money, and you will save so much of healthcare. And please get involved.